Today's topic of the Medicine of the Week is a drug called dexamethasone. Dexamethasone is a synthetic glucocorticoid with a minimal mineralocorticoid effect and has various applications in medicine. Let's talk about its mechanism of action. Dexamethasone, as a typical corticosteroid, binds to specific intracellular glucocorticoid receptors. The activated hormone receptor complex penetrates the cell nucleus, leading to modulation of gene expression. As a main result, dexamethasone inhibits the transcription of pro-inflammatory cytokines and enzymes, thereby suppressing the immune response and inflammation. Dexamethasone also has a number of other effects, such as metabolic changes, including increased gluconeogenesis, risk of hyperglycemia, dyslipidemia, and visceral obesity. It also has a catabolic effect on proteins and a negative effect on the central nervous system, manifesting as sleeping disorders, depression, and behavioral changes. So what are the typical indications of dexamethasone? Thanks to its anti-inflammatory effects, it is used to treat inflammatory conditions such as asthma, rheumatoid arthritis, allergic reactions, and to manage cerebral edema, increased intracranial pressure, or shock states. It is also used as an immune suppressive agent in case of organ transplantation or autoimmune diseases. Another indication, although still off-label, is the prevention and treatment of nausea and vomiting associated with chemotherapy. Dexamethasone is also recommended for severely ill patients with COVID-19 who are on supplemental oxygen or ventilatory support. Last but not least, we should mention the dexamethasone suppression test that is used to diagnose Cushing's syndrome. Let's look at pharmacokinetics. Dexamethasone is well absorbed after oral administration, and the peak plasma concentration is reached approximately in 1 to 2 hours with a high inter-individual variability. It has a plasmatic half-life of approximately 3 to 4 hours, but may be prolonged in case of hepatic impairment. The biological half-life of dexamethasone is much longer, ranging from 36 to 54 hours. This time is generally longer than plasmatic half-life because it considers the time needed for the drug to be eliminated from tissues and organs as well as from the blood. It takes into account both processes of elimination and distribution of the drug throughout the body. The drug is about 77% bound to plasma proteins and undergoes hepatic metabolism primarily via cytochrome 3A4 enzymes. Dexamethasone and its metabolites are eliminated mainly by urine. Another significant characteristic is the ability to cross the blood-brain barrier and enter the brain tissue. This explains dexamethasone's effectivity in treating conditions like cerebral edema, but it also means that it can cause neurological side effects. Dexamethasone can be administered orally, intravenously, and intraarticularly, for example in the case of osteoarthritis. As with all glucocorticoids, dexamethasone also has several side effects. Patients may experience mood changes, including irritability and agitation, increased appetite and weight gain, or sleep disorders. Due to immune suppressant effects, there is an increased susceptibility to infections. Other side effects include fluid retention, hypertension, electrolyte imbalances, and gastrointestinal disturbances such as peptic ulcers. Long-term use or high doses of dexamethasone may increase the risk of more severe side effects, including adrenal suppression, Cushing's syndrome, osteoporosis, and also psychiatric effects such as depression or psychosis. When prescribing dexamethasone, you should also remember some significant interactions. Concurrent use of NSAIDs may increase the risk of gastrointestinal ulcers and bleeding. Furthermore, it increases blood glucose levels, so dose adjustment of insulin and antidiabetics may be needed. Dexamethasone may also enhance the nephrotoxic effect of calcineurin inhibitors such as tacrolimus or cyclosporine. Attention is also required when co-administered with cytochrome 3A4 inhibitors or inducers. Altered plasma concentrations and potential changes in therapeutic response may be observed. To summarize, dexamethasone is a potent corticosteroid that binds to glucocorticoid receptors, leading to modulation of gene expression and suppression of inflammation and immune response. It is used to treat various inflammatory conditions, allergic reactions, manage cerebral edema, and prevent nausea and vomiting associated with chemotherapy. Dexamethasone can interact with several medications, so be careful when prescribing together with NSAIDs, tacrolimus, rifampin, or clarithromycin. Thank you for watching.